Next, we're going to talk about an open bite. An open bite is another form of malocclusion in the same realm as a cross bite. So occlusion, just a reminder, is when you bite down your normal bite as if you're chewing, where you have the most contact between your opposing teeth. And malocclusion is when you don't have that typical ideal contact, maximum amount of contact between the opposing teeth. One form of malocclusion is an open bite, which you can have in various forms. So you can have an anterior open bite, which is when your front teeth do not come in contact, but your back teeth do. You can have a posterior open bite where the back teeth come in contact. The front teeth come in contact and the back do not. As you can imagine, both of these, but especially a posterior open bite, can come with many issues like inefficiency in chewing and swallowing. The whole process of eating can take a lot longer when you have an open bite. And then an open bite can also be a very big sign that the forces in your oral cavity are not ideal, right? So if there was a balanced amount of forces between your lip seal and your tongue pushing or acting within inside of your teeth, then the teeth would not be in this elevated, proclined position that is created when there is some kind of imbalance. So a myofunctional therapist is a great person to actually evaluate why an open bite may be occurring, in addition to speaking with an orthodontist, especially one who is knowledgeable about the airway. So to check for an open bite is very easy. If you're doing this on yourself, you'll just stand in front of a mirror. If you're doing this on your child, I'd have them lie on their back just so you can get a little bit more of a stable position. And you're just gonna evaluate the teeth contact. So you're gonna bite down your normal contact and you're gonna look in the back, making sure that the molars contact, same thing on the other side. And then you're gonna look in the front. Typically an anterior open bite, or the one in the front, is very obvious, and you typically will see it in photos and just in someone's mouth when you're speaking to them. So it's gonna be when we talked about in the previous video, your front teeth are not supposed to be tip to tip. Instead, there should be a little bit of overlap, both in the horizontal and the vertical plane of your top teeth over your bottom teeth. So if you have an open bite, you'll have no overlap, if that makes sense. Okay, so if you're following along on your self-assessment form, go ahead and circle open bite if you notice this within yourself or your child. If you have any questions about an open bite, please write them in the comment section below. Find me at summerspt.com or reach out to your local myofunctional therapist. And if you'd like a full myofunctional therapy self-assessment form to use as you follow along, go ahead and click the link below, enter your email address, and a full myofunctional therapy assessment form will be emailed to you.